A lot of hospitals, they'll do it what we call a Braden scale. And that Braden scale has 6 subscales, and it talks about the mobility of the patient, nutrition, shear friction potential, um, and overall, if they can move or not. It gives you a subscale. And that scale gives you a number that falls into a low, moderate, no risk, moderate risk, low risk, high risk, very high risk. And based on that assessment, that will tell the nurse exactly where they're at with the possibility of breakdown. A lot of hospitals will then take that subscale and say, okay, for this subscale, if it's a 1, you do this. If it's a 2, you do that. And that's based on the standard of practice and articles and research that have been done in the past in order to try to prevent a pressure injury from occurring. But a lot of the best practice, just to name a few, is the turning, repositioning, nutrition consult to make sure they're receiving the proper nutrition. If they are incontinent of bowel, if they're incontinent bladder, some of the ointments, the creams that would be applied, and just preventative if they have dry skin, to hydrate. But the head of the bed also, but sometimes even with the head of the bed, as low as possible. With patients on a ventilator or tube feed, we do need to keep them up because we're afraid of aspiration pneumonia. So they're based on the Braden scale, and that will guide them to what the best practices for prevention are, based on, I guess, their wound care team, whoever wrote that procedure and policy to follow.